Great to have Dr. Fahmi Farah on with us. Day early. Normally she's on Wednesday, and with the holiday coming up right around the corner, I wanted to bring her on board early to talk about some holiday no-nos. Things that you should not be doing. And that is, for example, maybe not setting off those firecrackers. If you're going to do that, fine. But make sure you don't get burned. Make sure that the people around you don't get burned. Dr. Farah, welcome to the show. And I've got to imagine that, say, with the fireworks season here and people lighting those things up and watching them go zoom, that emergency room doctors are going to be very busy, say, maybe dealing with a burn. Pick a body part, could be arm, feet, or whatever. That, I've got to imagine, if you're being treated for maybe, say, a burn from a bottle rocket or whatever, that's going to accelerate that heart rate, right? What, does the heart go into overdrive with a burn? Welcome. What do you think, Doctor? What's your thoughts?
Hey there, it's great to be on your show. Yes, I absolutely agree with you. Yeah, I would encourage everybody to stay very careful with fireworks this year. And as you mentioned, being near the fireworks, especially for those who have had pre-existing heart conditions, it can provoke anxiety and, elevated heart rate, blood pressure. So definitely be careful with that.
And, when you look at the overall aspect of that, it is really something to factor into consideration. Correct in that, because when you're looking at, say, getting a burn, you could get a second-degree burn or a third-degree burn, and that makes the heart work much harder, doesn't it?
It does, yes. A burn can be pretty bad, especially if you have a third-degree burn that can put strain on your heart. So avoiding that would definitely be a good idea.
Okay, and when looking at some of the other things that are going on as far as the situation is concerned with the summer, we're thinking July 4th. Now we've got a resurgence in COVID going on. Is this kind of a normal thing with the summer here, resurgence in COVID? What's going on there?
I wouldn't say that it's normal, but certainly, yes, we are seeing a surge in COVID numbers, pretty high right now, and the new variant is called FLiRT. It's quite contagious, and so, I would advise everybody to take the appropriate precautions. Lots of people traveling, it being summer, so there's spread that can happen pretty fast. So I would ask people to be very careful, wash your hands, and just bring back some of those old habits from the pandemic era, like if possible, wear a mask when you're traveling, especially in airplanes and things like that.
Well, and the COVID, what goes on with the COVID virus? Is that something that just kind of replicates itself, gets worse as time goes along? It's always been fascinating subject to me. People have gotten really, really sick, but what did it do, or what does the COVID virus do?
Well, COVID virus can do a number of things in our body. Of course, it's a viral infection, so the immediate thing would be if people get pretty sick, they can get fever, runny nose, body aches, fatigue, but it could also have long-term effects. We've had studies that have shown that COVID actually worsens heart conditions. There was a large-scale study done, over 1 million people were looked at, and across the board, we noted that COVID increased heart disease on all spectrum, like many different types of heart conditions were worsened. So it's not just the heart. COVID can have an impact on other organs as well, like lungs, for example. And there's something called long COVID hauler, where long hauler COVID, where people who've had it, they have ongoing symptoms that are pretty debilitating. That's not for everybody, but many people are suffering from that. So COVID is not something we should take lightly, and this resurgence is concerning, and I do think people should take the appropriate precautions to prevent that.
I was reading a term, Dr. Farah, that it is an endemic. What is that? What's an endemic? Is it a pattern that is simply being set up? What is that, an endemic?
Yes, so pandemic means, we all know what pandemic means. Endemic means that a little bit less than pandemic, but primarily the key message in endemic is that it's not going away. It is something that's here, and it's here to stay, and it's a long-term thing. When we label something as endemic, it means that it's here to stay, it's going to be long-term, and we just kind of have to learn how to live with it and take the precautions.
Okay, and from that standpoint, when you look at the COVID situation, is this something that is constantly mutating in people, enhancing its ability to survive? In other words, new variants, new subvariants that are expanding, making it more challenging for medical personnel?
It is. That's the general nature of most virus. Virus, they're very intelligent. As they infect more people, their chance of survival becomes higher. And yes, they mutate as they infect more and more people, and they change. So what that means is, like, as we're getting smarter to, kill this virus, the virus also can outsmart us and figure out ways to, survive, basically. So the more infection that occurs, the more people it infects, the higher the likelihood of this virus surviving in the long run, because it just figures out how to mutate itself and becomes better at surviving.
Drivers, you think about it for a minute. Maybe you're feeling sick, just not feeling right. Could be COVID. That's why you maybe got to get into a doctor and just try to, find out what the source is and try to get it to go away from there. Dr. Farah, some might think, well, even though it's summer, maybe it's just a cold. Maybe it's a summer cold, but this, in your estimation, does this maybe mean it's especially important, even if it's maybe just a cold or COVID, to get a booster shot just to play it safe?
I definitely encourage people to stay up to date on all their vaccinations, especially COVID vaccine with their boosters. And this summer, if it's a cold-like symptoms, don't ignore it. At least get tested to make sure it's not COVID, just so you're not transmitting it to others.
Okay, let's do this. We're going to break. I'll put the commercials, and drivers jump in. Dr. Fahmi Farah is on the phone with us. The number to call in, it's 888-876-2336. Is it a summer cold that you've got right now, or is it maybe a COVID case? Yeah, COVID is still around. It's not gone away, not going away. But if you're feeling rotten just right now, just rotten to the core, maybe it is a COVID case. That's why you got to get in and see the doctor. These little items certainly can have an impact on your heart if you got a pre-existing condition. Stay with us. We're going to be back in a minute, right here on SiriusXM 146. Hey, drivers, yep, we're back, and good to have you on board. Are you feeling rotten right now, ladies and gentlemen? Just not all there. Is it a cold, summer cold, or could it be COVID? Yeah, we're seeing a resurgence, believe it or not, and it's not done. COVID has not gone away completely, and it's still here. It's still a thing. Many are experiencing COVID-like symptoms right now. And on board, Dr. Fahmi Farah. And, Doctor, thanks again for joining me on the program. We did not mention where folks can find you at the beginning of the program. Where can they find you up on the web? Where can they go?
You can find me at www.drfahmifarah.com, also on social media at Fahmi J. Farah on Instagram and X. Okay,
thank you very much for joining me on the program. The COVID pandemic from a couple of years ago was horrifying, to say the very least. I mean, we lost millions of people on a global scale. Science came to the rescue and came up with new vaccines, new programs were launched, and we seem to have mitigated it to some extent. But I would think that this is a kind of story that should be on everybody's radar. I mean, the fact that maybe we're seeing a resurgence in COVID in some areas, talks about the importance of getting that booster and talking to your doctor, letting them know if you're feeling rotten, right? Because can't they do a test to determine if you've got the flu or COVID or even more? Can't they do that? What do you think?
Yes, they can, yes. So I totally agree. If you have any of those signs and symptoms of runny nose, fever, anything that suggests it could be COVID, you should talk to your doctor. Get a test done. Tests are very simple now. You can even do it on your own at home. And knowing it is very important because there are many different treatments available for COVID now, so you don't have to suffer.
Well, and from as far as the heart is concerned, this is especially got to be problematic, correct in that? Like you mentioned earlier, if somebody's got maybe a pre-existing heart condition, then this really should accelerate the need for that person to make their way to the doctor, right? Because the doctor is going to be able to say, okay, you've got this pre-existing condition going on with the heart. We need to do this treatment or that treatment. Not all treatments are going to be working for everybody. Am I correct in that? And that's why the doctor should be there to narrow it down. What is going to be the best option for medical or maybe a medicine regimen or maybe some other kind of alternatives that could be used, correct?
That is correct, yes. As I mentioned earlier in the interview, COVID can cause some serious damage to your heart, and especially those who have pre-existing heart conditions, it can worsen those. So talking to your doctor would be the right way to go because, as you mentioned, it needs to be individualized, and your doctor would be the best person to do that and guide you in the right direction.
Okay, say somebody, for example, is in your office and that maybe they've been diagnosed for COVID-19. What kind of regimen would you put them on to maybe try to stabilize their heart? Would it be maybe a prescription regimen or maybe some other approach to try to mitigate the effects of the COVID on the heart? How would you approach it?
Well, if it's an acute infection with COVID, then if it's within the first 24 to 48 hours, there are medications we can give to this patient to prevent, major impact happening from the COVID, to slow down the infection, so to speak, so the virus does not have as much of an impact on their overall body, especially the heart. And then if this is something later and, COVID is now creating an issue for the heart for this patient, then of course there are more specific measures we'd be taking for that individual based on and depending on which area of the heart is affected. So it'd be more individualized and more specific based on where the problem's at.
Okay, and could this indeed, a COVID scenario, maybe cause heart inflammation? What is that? How would you treat maybe heart inflammation, say, with COVID?
COVID has been known to cause inflammation of the heart, and it can cause inflammation in separate areas of the heart. There's one area, it's called the pericardium, that's a sac. The heart is encased by a covering that's called pericardium, and if it causes inflammation in that area, that's called pericarditis. It can lead to symptoms of chest pain, shortness of breath, and fluid can build up around the heart. So that has its own set of treatment regimen with certain medications. And the other area it can cause inflammation is the heart muscle itself. That's called myocarditis. It's a little bit more serious and a little bit more dangerous because that can cause somebody to go into arrhythmia, like ventricular tachycardia, and people can have cardiac arrest. So for those reasons, COVID is not something we should be trying to, ignore the symptoms or the risk factors and the complications that can arise from it can in fact be serious, and you should see a doctor, and especially a cardiologist, if that should happen.
When you mentioned some of the side effects that could go on, what would those be? Go into that, if you will. Side effects on all that.
Complications of
Yes.
COVID, as we just mentioned, inflammation is one of them. Rhythm problem could be a major one that we're seeing. It has been known to increase arrhythmia in patients, like people who already have atrial fibrillation that can be exacerbated. They can go into erratic heart rhythm as a result of that. It has also been known to cause AFib in those who do not have AFib. So we've been seeing a lot of the younger folks coming in with rhythm problems such as atrial fibrillation since the pandemic and post-pandemic than we had in the previous years. It can also cause somebody who has had pre-existing blockages, for example, viral infection like COVID can destabilize the plaque that's inside your heart, and it can actually cause a heart attack. So people's risk of heart attack can go up as a result of COVID infection, and that's true for other types of viruses as well, for example, the flu, and that's part of the reason why we encourage everybody to get the flu shot every year, especially those who have pre-existing heart conditions, and the same is true for COVID.
Okay, absolutely. Is there a time window that folks should be looking at getting that flu shot or the COVID shot? Some might say, or I've heard early fall is really the best time, or should it be now is the best time? What do you recommend there?
Early fall is usually the time, recommended time. That's when the flu shots come out. That's the best time for flu vaccines. And for COVID, really any time is good. You just have to keep up with your booster shots. So you have to talk to your doctor and see when your last booster was and if you're up to date or not. And based on that, you should determine whether you're due for one or not.
Okay, very good. And that's all. It's all about forming that collaborative partnership, that bond, if you will, with your physician. They're going to be the front line of defense, and then if the complications go beyond that, that's when you will go see Dr. Fahmi Farah. That deals with cardiology. And, Doctor, thank you very much for joining me on the program. Happy 4th. And, again, one more time, the website for Bentley Heart and phone number. Where can folks find you? All the above.
Happy 4th of July to everybody. It was great being on this show. You can find me at www.drfahmifarah.com, also at Fahmi J. Farah on Instagram and X.
Outstanding. Doctor, thank you. All the best for the holidays. That is Dr. Fahmi Farah.